Hello, everyone. Good evening. Welcome to the Rotary E-Club talk show on COVID-19. It is my pleasure to welcome you to this first talk show of 2021. We have a special guest, a very talented expert in the field, Dr. Nausheen Hakim, who will give us an update on the current status of COVID-19 in the United States, as well as she will highlight any update on the vaccine, because we all are concerned about the vaccine and future of this pandemic. So it is our pleasure to have Dr. Nausheen Hakim with us. And all the viewers, we have this show live through the Rotary page. So please watch it. And if you have questions, please write in the comments box and below the show. We welcome any kind of comments, concerns, and questions. The speaker will, after her presentation, she will try to address all the concerns or questions you have. Now, it is my pleasure to welcome the president of the club, Said Zaki Hussain. All our viewers hope you know Zaki Hussain. He is by profession an engineer and an entrepreneur, but he is very well known for his contributions to the society in New York, in USA, and also in Bangladesh. He has been contributing in all different forms. So we are very fortunate to have President Zaki Hussain lead this club, Rotary Club. President Zaki Hussain, welcome to the show. And I would now request President Zaki Hussain to give a welcome speech. President Zaki Hussain, please.
Assalamu alaikum. Assalamu alaikum and good evening. On behalf of Rotary Heritage of New York, I welcome all of you to our COVID talk show tonight. We hope you will find it helpful. There is a light at the end of the tunnel of this global pandemic with the introduction of the COVID-19 vaccine. It is something that we have been waiting desperately to come out and help the whole world. However, there are some who do not understand the science behind the vaccine or the global need for every adult person who is medically able to receive and receive vaccine and make the whole world safe. Tonight, we have a young Rotarian doctor who will discuss the critical importance of vaccination plus transmission, prevention, and symptoms of COVID-19. Before I hand over the microphone to the MC, I'd like to thank you, our Secretary, Rotarian Dr. Nozrul Islam, for putting this show together for us. Thank you. You are muted.
Thank you, President Zaki Hussain, for your kind remarks and wonderful leadership. This show was organized by our membership coordinator, Rahat Hussain. I would like to acknowledge her contribution. Let me now introduce our speaker, Dr. Nausheen Naila Hakim. Nausheen, welcome to the show.
Thank you.
So for audience, let me give a brief introduction to Nausheen. She is a hematology and oncology physician in New York City who has strong interest in end-of-life and palliative care. She's originally from Iowa, moved to New York for her undergraduate education at Columbia University. She has been working with AmeriCorps in the South Asian Youth Action nonprofit in Elmhurst, Queens. Now she's focused on how to improve the quality of life for patients in whatever context they may be. And the most important thing is she's also passionate about arts and culture. She's a dancer, piano player, and we hope to watch some of her music performance and dance performance in our future shows. So today we would like to welcome Dr. Nausheen Hakim and enlighten us on the status of COVID and vaccine.
All right, thank you so much. Thank you for that introduction. Okay, so, we're going to have this talk now, and I'll go through the plan of, the next hour or so. So yes, I am a hematology oncology fellow at North Shore and LIJ Health Systems, the Northwell Health Cancer Institute. So during the initial peak of the pandemic in New York, as fellows, we were actually redeployed to work at North Shore and LIJ to help with just the increased number of hospitalizations. I treated many COVID patients on the medical floors with my colleagues at a time when we really did not know much about the disease and what was going on. So now, this many months later, I can say that has definitely changed. We know a lot more. There's still a lot more to learn, but we've definitely come a long ways. So for this talk, we are going to go over the most recent COVID updates, the vaccines, and frequently asked questions people may have about the vaccines. And we're going to open it up for discussion as well and more questions at the end. And my hope is that by going through even the basics of COVID, transmission, and then talking about the vaccines, everyone will have a better understanding of our current status. So this is a picture you've probably seen. This is the SARS-CoV-2 virus. So COVID is actually the disease that's caused by this virus. And this is part of the coronavirus family, which is actually a family of multiple different viruses within the same kind of framework. There, specifically for SARS-CoV-2, it has 4 structural proteins, which are S, the S spike, which is something to remember for later on, M, which is the membrane protein, E, which is the envelope, and then N, which is the nucleocapsid. And the spike protein has an affinity to ACE2 receptor, which you've also probably heard, which is the mode of entry into the cell. So these are 3 different ways that COVID is transmitted. So droplets are actually the primary vector of COVID. They can spread the eyes, the nose, or the mouth. And, the thought is they don't actually remain airborne for long. And that's why you hear 6 feet is, the social distancing limit that we need to be away from each other. And we still need masks, though, for the best prevention. So then there's fomites, which are actually contaminated objects or surfaces that can transmit the virus from your hands to, say, your eyes, nose, or mouth. Hard surfaces like metals and plastic are more likely to do this than softer objects, and hand washing can prevent this, and good, very good, vigorous hand washing. And then aerosols are the particles that infected people exhale when shouting, singing, or speaking, coughing, things like that. Unlike droplets, aerosols can actually remain airborne in the air and can travel. So, when in small indoor places, poorly ventilated places, they can actually stay airborne for a while. So the best situation here is to wear masks, and actually being outdoors is really the best kind of prevention. And then you've also heard of community spread, which is virus infecting one area and people aren't really sure how or why they got infected. So this slide again emphasizes that the chance of transmission is the absolute highest without masks and within 6 feet. And so we wear masks, as you can see, not only to protect ourselves, but actually more so to protect other people, as shown in the second row here. And then if you go all the way to the bottom where it says practically none, that's when we're totally away from each other in our own houses. So there are some other questions about transmission, including warm weather. We're not quite sure if the warmer weather will affect transmission or not. As we know, in New York, during the summer, our numbers went down a lot, but that's not really the case in other parts of the country. And then also in terms of mosquitoes, ticks, and other animals, as of now, humans have really been, the way that this has been spreading. So again, more forms of prevention. The best thing to do is to wear a mask. Wear a mask when you're outside of your household and you cannot maintain social distancing of 6 feet. Some prime examples are at the grocery store, the mosque, friends, family members' houses that are not in your own bubble. You have to wear a mask. Social distancing, greater than 6 feet, staying away, that's really important. And then the other important thing I want to point out is do not forget to keep up with your other medical conditions. It's a good idea to plan ahead. Try to have a 2-week supply of extra any meds that you take regularly. And I absolutely want to emphasize to not delay seeking emergency medical care for any condition for fear of getting COVID, let's say in the emergency room or urgent care. So first of all, in the emergency room, the way that they are separating patients, if there's a high suspicion, they're separated from everybody else. And also everyone who gets admitted to the hospital is tested. So I just want to emphasize, do not neglect any other medical conditions. It's really important to keep up with that. So this is a slide comparing symptoms of, a few common things that we get. So allergies, the cold, the flu, and COVID. So as you can see with the yellow, for COVID, the most important difference here is you usually will have some kind of shortness of breath or difficulty breathing, some involvement of the respiratory system. For the flu, you may not necessarily get that. It's actually pretty rare. But, there is a lot of overlap here. Coughing can be seen in multiple different of these. Fatigue, those fevers and those chills can also be seen. I think the other thing to think about are what are the warning signs for when you really have to get evaluated. And those are trouble breathing to the point where your oxygen may drop, chest pain, feeling confused, the inability to stay awake, and any change in the color of your lips to blue that obviously needs to be evaluated. You also may have heard that the incidence of influenza is actually less this year. Some theories behind that are really because everybody is wearing a mask and social distancing. It's still there, but it's a lot less. Still very important to get the flu vaccine. So this is a slide taken from the New York Times of the New York State specific cases overall. So thus far, we've had around 564,000 reported cases. Again, our testing is a lot better. It wasn't great in the beginning. And as of January 22nd, which is when I made this presentation, there were 6,800 that day. And there were around 26,000 deaths thus far. So these are the new deaths in New York by day. So, all the way to the left, you see in March, a lot more than what's going on now. So this is actually looking at the United States overall. So March all the way on the left into where we are around right now. So overall, there's been around 24.9 million cases and around 415,000 deaths. I want to point out, there's the 30% decrease, as you can see in the 14-day change all the way on the right. A lot of that's being attributed to the fact that we had a spike during the holidays, and now we're kind of coming down from that. So I just wanted to point out here that these are the top 10 states in the United States, and they are including the daily averages for the last 7 days. Specifically California and New York. You can see that New York has 1.3 million total cases, Our daily average in the last 7 days is 13,000. We are less than California, but it's still, it's a situation in New York. So these are the new reported deaths by day. So there's a stark contrast here, as you can see. We had really gone down during the summer months, and we've peaked again. So this is an interesting graph where it shows our weekly deaths kind of above and below normal since 2015. So normal is actually the very bottom line of this graph. That's the normal amount of deaths, at any given time. And so kind of in the middle, you'll see in the 2017, 2018 flu season was particularly rough. We did have an abnormal amount of deaths. And then, all the way to the right, this is the COVID-19 pandemic. So it's most, very increased. And in the world, as of the 12th of January, they estimate around 2 million people have died. So what do I do if I have symptoms? So number one, get tested. In New York, our testing has really improved. There are multiple places to get tested. And we'll talk about that in a second. Stay home from work, stay home from public places. Monitor your temperature and your pulse ox. So it's important to keep a thermometer at home as well as a pulse ox. Stay hydrated. And then if you need to go to a medical provider, just let them know of what's going on beforehand. Let them know that you're suspicious of COVID. Even if you go to the emergency room, it's a good idea to also let them know. Wash your hands and cover your mouth, and wear a mask around other household members to prevent spread. The other thing is to quarantine for 14 days. The incubation period for COVID is thought to extend to, again, 14 days, with a median time of 4 to 5 days from exposure to symptoms to when you actually feel the symptoms. So testing in New York, if you go to a test run by New York State, you go to the New York State government website, you will not be charged. And uninsured people can also be tested. They will ask for insurance, but it's best to be, honest at the beginning if there is no insurance. If you do test positive, number one, and notify the New York State contact tracers. It's really important for us to be able to track spread. Also notify anyone you've been in contact with up to 2 days prior to the start of any symptoms. And then after you've tested positive, when can you be around other people? So 10 days since the symptoms first appeared and around 24 hours with no fever without using like Tylenol or something like that. And then all your other symptoms are improving. When those three things are happening, then it's okay to be around people again. So this is on the New York State website in terms of finding a COVID-19 test center. I just put it in the zip code here. If you submit it, there will be multiple test centers that come up. You can make an appointment and get a test. There's also many urgent cares and places like that that you can get tested. So it's important to remember that most people, 81% of people, will have a mild to moderate symptom profile. The severe, in terms of when you need to be hospitalized, that's around 14% of people, and then critical, like the absolute worst case scenario, is around 5% of people. These are the high-risk groups with conditions related, that Bangladeshi people do have a higher incidence of that are highlighted and bolded here. So for us specifically, chronic kidney disease, heart conditions such as heart failure, coronary artery disease, obesity, and type 2 diabetes are all things that do make people high risk, as well as, I just want to point out specifically, cancer too. So reinfection, right now we have limited data, but what we do know is that if you do test positive for COVID, even after you've stopped displaying symptoms and you feel better, the test can actually remain positive for around 3 months. So it's not really worthwhile to get retested unless something else happened, but because you may just still be positive. So treatment. Remdesivir, which is a name I'm sure you've heard at this point, is the only FDA-approved therapy for COVID-19 at this time. It is an antiviral medication. It is given through an IV, and indications are for hospitalized patients who require supplemental oxygen. So I just want to take some time here and point out the difference between approval and emergency use authorization, which we're going to get into in the next slide. The emergency use authorization process is different than an FDA approval process. So under an EUA, or the emergency use authorization, the FDA makes a product available to the public based on the best possible evidence, without waiting for all of the evidence that would be needed for, let's say, like an FDA approval. So when evaluating an EUA, the FDA carefully balances potential risks and benefits based on the data we currently have. And this is effective until the emergency declaration is over. And as new data emerges, the EUAs can actually be revised by the FDA. Corticosteroids are also used. These are something used in many, many different diseases. The one that you probably hear about the most is dexamethasone. And that's been shown to improve outcomes in severely ill patients. In the hospital, we typically give it if people are requiring oxygen. Some common side effects of all steroids are blood sugar elevation, which is going to be watched in the hospital. Can also give headache. You can also feel very hyper. So those are some things to remember. So moving on to some of the medications that do have these emergency use authorizations by the FDA. So these are monoclonal antibodies by Regeneron and Lilly. So the Regeneron and Lilly monoclonal antibodies are pretty similar. They both neutralize, they both basically bind to the spike protein to block it from entering the host cells. And the indications are for non-hospitalized patients who are at high risk for progressing to severe disease or to end up in the hospital. And the way that these were done, they had, clinical trials just like the vaccines, and, patients were monitored to see if they did develop severe COVID. And these are actually pretty well tolerated. Monoclonal antibodies are not new. We actually use them frequently. And, some side effects might be an infusion reaction, but people are actually monitored in an infusion center. And some people also experienced headaches. So people who are eligible are high-risk groups. Again, chronic kidney disease, diabetes, immunosuppressive disease, so basically cancer patients. Anybody actually over the age of 65 is eligible. And then people who are over 55 who have any kind of heart disease, hypertension, or COPD, or like a respiratory disease. So again, the way that this works is your primary care physician, your specialist, for us, actually our cancer clinic, we do this a lot, is to call and schedule the infusion for you. And I've actually scheduled many patients myself for this, and it's pretty well tolerated. So now moving on to some different categories. So these are medications that are not recommended either for or against. So kind of in this period where we're still collecting data and there hasn't been like a no/yes. So convalescent plasma from donors who have recovered from COVID, they actually may contain antibodies to the virus that may help suppress the virus and modify the inflammatory response. You've probably heard of people going and donating blood who've recovered from COVID, and this is what we infuse. So, again, this has been shown to help in some way, but not in a way enough where it can be recommended fully. People are still studying this. And then ivermectin, which is, strongly again recommend speaking with your healthcare provider prior to taking. It is an anti-parasitic drug that a lot of us are pretty familiar with, and it is approved to treat parasites. There have been some studies in the lab, as well as some other smaller studies, to show that it can affect that spike that we saw in the first slide of the SARS-CoV-2 virus. Also, it has been shown to have some anti-inflammatory effects. Remember that, the COVID disease is an inflammatory syndrome, so this may work. But again, further studies are needed to determine if it works. And before we can say, yes, 100%, this is something that has been helpful. There are some side effects. Convalescent plasma, some side effects are, again, infusion reactions. Some people might get itchiness. And then some side effects of ivermectin are, people might get itchy. They might have a rash, may have some diarrhea. So anticoagulation or blood thinners. So people, again, with this inflammatory response that COVID-19 does give to people, people have a higher propensity for clotting. And people who are actually found to have clots in the hospital will be discharged with a blood thinner. And that depends on kind of what the situation is as to which blood thinner, but that will happen. People who are at high risk, and those factors are determined in the hospital based on different labs or kind of based on what the clinical presentation is. Those people actually may be discharged with a preventative dose of a blood thinner for a certain amount of time. And that's really important. If people are determined to be high risk, they really should take that blood thinner to avoid any clots. And, there are, of course, risks of taking blood thinners in terms of bleeding, but the doses that you'll be taking are more preventative as long as it's not to actively treat a clot. So medications that are not recommended are hydroxychloroquine and azithromycin. And, there are maybe some further clinical trials that medicines will be given like this, but not outside of one, this isn't really to be given. So now moving on to talking about the COVID-19 variants. What do we know? So thus far, we know of three. The first one we started hearing about was B.1.1.7, which originated in the United Kingdom. What we do know is it spreads more easily and quickly, but we don't have any evidence that says that it causes more severity of illness or deaths. There's also 1.351 and P1. The South African variant actually shares some mutations with the UK variant, and that has not yet been detected in the US. And then there's P1, which was identified in Brazil. This seems to have additional set of mutations, and I think as of yesterday, we've just detected it in the US. So again, overall, these variants seem to spread more easily, but again, they don't really seem to cause a greater amount of severity of illness or death. But as we know, more cases does mean that the hospital, which, even if they're not at full capacity now, more cases can cause that. So that is something to think about. So again, COVID-19 variants, what we don't know is how widely the variants have spread at this point and how the variants affect therapies and the vaccine. However, Moderna has done some studying into this, looking at both the UK variant and the South African variant. And it seems at this point that the Moderna vaccine is still able to provide antibodies against these variants. Again, Pfizer as well has been looking into this, and they are also able to, as of now, to find antibodies against the UK variant. More studies, of course, are being done against these variants. Okay, so moving on to part 2, let's talk about the vaccines. As of now, we have 2 vaccines, the Pfizer vaccine and the Moderna vaccine. The emergency use authorization for Pfizer was on December 11th, and the emergency use authorization for Moderna was on December 18th. The full clinical trials are published, as well as the methods, the vaccine ingredients, how it works, and the side effects in the trials. There were rigorous hearings by the FDA to approve the vaccine that were done on those days, hours long. So just briefly, how does the mRNA vaccine work? So remember those spike proteins that we talked about in the beginning. So scientists figured out how to code for the spike protein with messenger RNA, which basically is just a code to our cells. So the code goes to our cells, and then that's how our cells make proteins. So the way that this works is the code is then packaged up within lipids and then sent to our cells. And then once in our cells read the code and can make copies of the spike protein. The proteins that are made by our own cells encourage our own immune system to produce our own antibodies that can protect us if we are exposed to COVID, to the SARS-CoV-2 virus. So again, what this is doing is making a copy of the protein itself, not giving us any part of an active virus. So the mRNA vaccine is not new, which is important to remember. Some vaccines that are thought of as traditional do have an actually inactive part of a virus. I'm looking at the right here, that then is exposed to our body, and it takes more time for our body to perhaps produce the right antibodies. This mRNA vaccine is faster because the mRNA molecules are actually easier to produce. And but they both work the same way. They're injected into our arms, and they're basically teaching our body to, how to react if we were exposed to the virus. So again, I want to reiterate, can you get COVID-19 from an mRNA vaccine? And the answer is no. The mRNA vaccine, again, does not contain a live virus, and it does not carry a risk of causing disease in the vaccinated person. Again, it's just a code. So these are the ingredients. Pretty short list, but basically in both sets of vaccines, they'll have the mRNA. That's the code we were talking about. Lipids are the code. So lipids, like your lipid panel that you get at the doctor, including cholesterol, basically that's what's, encoded. So that's what kind of can get the mRNA code into our cells. And then we have acids, acid stabilizers, and sugar, and salt and sugar. Those are basically ways to stabilize the vaccine and the molecules that retain their shape during the freezing process. So this is just kind of comparing the two vaccines, which we'll continue to talk about. But basically, one of the biggest differences, both are two doses. The Pfizer is administered around 3 weeks apart, and the Moderna is 28 days apart. As you know, the Pfizer vaccine does need to be stored at pretty cold temperatures, a little bit colder than the Moderna vaccine, which is why you may have heard in some rural areas, the Moderna vaccine will be the one to go there. They're both very effective, 95% effective for Pfizer, 94.5% effective with Moderna. Both had over 30,000 clinical trial participants. And the side effects here at the bottom right are pretty similar. Injection site pain, again, is really the most common. Fatigue, headache, some chills, joint pain, and some people did have fever. So going into this a little bit more, specifically with Pfizer, the most commonly reported reactions were local injection site reactions. Less than 1% of people were reported to have a severe reaction. And then we're talking again around 36,000 people. Pain was actually less frequent in patients who are above 55 years old. And most reactions really just resolved within 1 to 2 days. In terms of the chills and fevers, things like that, that was actually most common after the second dose. And also some people did report a headache. And then there's the Moderna vaccine, very similar. The side effects mainly included injection site events. And that can be like local irritation, some muscle pain. Some people had some redness there. And that really resolved after 1 or 2 days. After the second dose, people did report more side effects, fevers, some had chills, things like that. But again, those did resolve. So how long does it take the vaccine to work? So on day one, that's when you get the vaccine. You may have a little bit of pain. The next day, you might have some fatigue, some muscle soreness, maybe even a fever. And again, those are not necessarily a side effect of a bad thing. It could mean that your body is having your immune response. But again, those reside anyway within like 3 days. And then on day 22, you would get your second shot if you have the Pfizer vaccine. And then on day 29, you would get the second shot of the Moderna vaccine. For both vaccines, about a week or so later, you are then considered to be fully, it's going to be fully effective. So again, after the first shot, no. In the middle, you do have it has some effectiveness, but really you have to wait until the full days are done before you have that full 95% effectiveness. So now we're just moving on to some frequently asked questions. So what lasts longer, natural immunity or vaccination immunity? Natural immunity is the immunity you receive, after an infection and then your body has developed antibodies. So after COVID, it seems to be unlikely that if you do get COVID, you're unlikely to get infected again within 90 days. However, we are still collecting information as to how long the vaccine is going to protect us. It's something that we have to keep looking into. So next question is, what percentage of people need to get vaccinated in order to achieve herd immunity? Herd immunity means that enough people in a community are protected from getting a disease because they've already had the disease or they've been vaccinated. So herd immunity makes it hard for the disease to spread from person to person. And it can actually protect those who cannot be vaccinated, such as newborns. The percentage of people who need to have protection in order to achieve herd immunity varies by disease, and we do not know that percentage right now for COVID. Who is paying for the COVID-19 vaccinations? It's the US government. You should not pay for a vaccine. So, when you do go get the vaccine, they'll probably ask for your insurance, but, any costs or anything like that should not be happening. If I had COVID and recovered, do I still need a vaccine? The short answer is yes. I know it seems like, why, if I already have natural immunity? It's just that we don't know how long natural immunity will really last. And it seems that, the vaccine is something that we all need to take to really provide the best kind of prevention. Once I get the vaccine, do I still have to wear a mask? Again, the answer right now is yes. Until we really achieve herd immunity, we still need to be wearing masks. More recommendations about masks will be made as more of us are vaccinated. Some more questions. Is the vaccine safe? So again, going back to those emergency use authorization hearings, the FDA went through these really vigorous hearings with both Pfizer and Moderna, and the clinical trials are public and available to be read. They, really did go through every step. It's just that perhaps, some things were able to be sped up. Is the vaccine safe for people who are pregnant or breastfeeding? So as of now, the vaccine is available. It's a conversation to have with your GYN. But a lot of people I know, a lot of healthcare workers I know who are pregnant or breastfeeding have taken the vaccine and have chosen to take that vaccine. If I have an underlying medical condition such as diabetes, hypertension, or cancer, or immunocompromised, let's say, should I get the vaccine? The answer is yes. We are encouraging all of our patients at our cancer clinic to get the vaccine, to sign up as soon as possible. Another question is, should I wait for the next vaccine to be released? The CDC actually recommends signing up for the vaccine as soon as you are eligible for it. We do not know the timeline of the next vaccines. We do not know when they'll be released. There are many companies that are still working on creating vaccines, so that is there for the future. But the best thing to do right now is, as soon as you're eligible, is to sign up for an appointment. There's a lot of talk about allergic reactions. So they are extremely uncommon. And people who have allergies to latex or eggs, food, or pets should actually still get vaccinated. In the United States, according to the CDC, as of actually last week, January 19th, there were around 15 cases of anaphylaxis with the Moderna shot and 45 with the Pfizer shot. But that really translates to around 2.1 cases per million doses and around 6.2 cases per million doses, respectively, which are both very, very low rates. And the risk of contracting COVID-19 outweighs that posed by the vaccine. Also, anaphylaxis or allergic reactions are not, new. They are actually a known risk of vaccines, and they actually happen with the flu vaccine as well. It's just that the rate is so low with these vaccines. It's pretty rare. There were also, this article came out about a lot of people who in Norway who did die after the vaccine. It was shown that it was actually not related to the vaccine. A lot of these people already had a lot of comorbid conditions. And so it doesn't seem that the vaccine contributed to their deaths. So now we're going on to some myths that I would like to debunk. The vaccine affects fertility. So the COVID-19 vaccine does not affect fertility. The truth is, again, that the COVID-19 vaccine encourages the body to create copies of that spike protein, that S protein, found on the SARS-CoV-2 virus surface. And again, that teaches the body's immune system to fight the virus. There have been kind of these myths on the internet about how it affected a specific protein on the placenta, but no, that's not true. So number two, the development was too rushed, so it cannot be trusted. Again, the mRNA technique is not new. There are many processes in place already in development. The schedule was sped up, but no steps were skipped. And also, one of the big parts of clinical trials is to get lots of participants, right? We needed like over 30,000 participants in each trial. And social media really helped get volunteers that, the numbers needed for the trials. And number 3, the vaccine changes your DNA. No, it doesn't. Again, it's an mRNA code that basically just has your body produce the protein that will help create the antibody. More people will die as a result of the vaccine than from the actual virus. So no, again, we went over that the side effects were pretty rare and even anaphylaxis. And the other thing that we'll talk about a little bit more too is what happens when you get the vaccine. You're actually monitored pretty closely afterwards to make sure there is no allergic reaction. So here, I just want to show these faces. These are actually faces of my family, my husband, my parents, my cousins, my aunts and uncles. We have a family full of healthcare workers and, who have gotten the vaccine and are okay and, they're doing fine and they all recommend it. And I hope that these faces can kind of alleviate any concerns that you may have. We're all doing okay. So here are some more happy faces after getting those vaccines. You might recognize some of them. Okay, so let's talk about who is eligible in New York specifically. So right now, healthcare workers are eligible and should have been invited already to sign up. People who are age 65 and older are eligible. Many groups of essential workers. There is an Am I Eligible app you can go to on the New York State website to check if your group is included. People who are in-person college instructors who are going to campus. Preschool through 12th grade school workers, many childcare workers, grocery store workers, and public transit workers. So I know one of the questions are, when am I going to be able to go get the vaccine? So, what we are is in 1B. We're hoping to hopefully move to the spring to people who have certain underlying health conditions that are, considered high risk. This is all going to be determined by the New York State and all other essential workers. And then all other people who don't meet any of these groups, the goal is summer 2021. None of this is in stone. It really doesn't know. There's many factors here, in terms of how many vaccines end up getting approved, how fast, people can make the vaccine. So a lot's up in the air, but that is the goal. So how do I get the vaccine? You check the New York State government vaccination website. If you're in a different state, most states work the same, that you need to go to the government website and sign up online. The platforms are different per state. So if you're not sure, then, a lot of times, like people who have already gotten the vaccine, healthcare workers can help. And then you just schedule the appointment online when eligible. And if that's something that, that it's difficult to find out how to do this, it's something that younger people can also help with. So at this point, I want to thank you all for listening to me. I hope that was helpful and answered a lot of your questions, but I do want to open it up for any questions or discussion points. Let's have a conversation about this.
Thank you, Nausheen, for your wonderful presentation. And in fact, there were a lot of questions, but you kind of addressed all of them. And so people are very proud of you. So congratulations once again. We feel proud. Now, one question is, you already compared Pfizer and Moderna, highlighted their side effects, the structure. As a patient, does a patient have any choice to pick whether between Pfizer and Moderna?
So not really, not right now. It's really kind of what's available, and it really depends on what's going on at that vaccine site. So and as of now, as you can tell, they're very similar. So it really shouldn't matter except for that time frame.
Okay, good. And you already discussed some myths. So still there are people who believe myths and they are reluctant to take vaccine. So is there a policy if someone doesn't want to take the vaccine? what to do?
So, it's not necessarily mandatory right now. It's just strongly encouraged. We don't really know like what will happen in, let's say, a few months if there are people who never want to take the vaccine. How does that affect, the public? Or how does that affect activities they can do? Or we don't really know what the future holds for that. But I think the most important thing to focus on is if you're eligible to get it.
Is it like other flu vaccine that we have to take every year?
So that's a good question. I think as of now, we don't know. There may be boosters that we need. I think as we also learn more about these variants that we discussed, some of that, like we may need a booster or something like that. But we will learn more over the year.
Okay. Here is one question from John Graziano. He had his second vaccine due in 27 days. But as we hear around that there is a scarcity of vaccines. So what if he doesn't get the second dose?
So first off, hi, Mr. Graziano. That is my high school English teacher. And I think that they are, they've kind of expanded the time frame as to when you can get the second dose. I don't think that it'll affect the effectiveness, especially if they have extended that. I think the idea is to get as many people vaccinated as possible. So I know there are new recommendations. I can't remember the exact day, but people do have a little bit more flexibility with that second dose, and it is supposed to be okay.
Okay, good. We have another question from Vincenzo. J&J vaccine will only have one dose and won't need to be stored at low temperature. How is it different from others?
So I don't think we know as much about the Johnson & Johnson vaccine yet, except that it is exciting that it'll only be one dose. That's going to be really helpful for a lot of different people. Again, we'll know more when it's going to have to go through that same rigorous process through the FDA, and that those results will be published. So we'll know a lot more at that point.
Okay, awesome. I think you have covered anything. So any general comment for our audience?
No, I'm so excited that you were all able to join today. I hope it was helpful. I'm also available, for questions if you message me. If I don't know the answer, I will go find it for you. And speaking with a lot of my family members, I know that they all feel the same way. And so, we're here to try to answer any questions.
Awesome. And people who got the vaccine, they are excited to go to regular life without mask. You have already emphasized we cannot live without mask, right?
Yeah, I don't think we're there yet where we cannot wear masks, but I have to say that getting that second dose, there is a lot of sense of relief. Kind of like you were holding a deep breath for a really long time and you can finally exhale. So I think that that's something to look forward to have more people experience. And again, I strongly encourage as soon as you're eligible to get it.
Okay. And when do you expect to get all the citizens vaccines and we go back to normal? Or is there any chance that we will go back to regular life, pre-pandemic life?
I mean, I think a lot of things will become more normal. I'm not sure if it'll, ever quite be the same. I think we've learned a lot. I think a lot has changed, even with how we, like hold meetings, for example, even at the hospital. So I think a lot of things will stay the way that they are, but I do hope with the vaccine and herd immunity that things will eventually be a little bit more normal.
We hope so. And we hope that everyone will get the vaccine, and with or without vaccine, we hope everyone stays safe. Thank you, Dr. Nausheen, once again for your awesome presentation. And dear audience, Dr. Nausheen and Hakim will be available to address any questions. If you have further questions after this show, please write on our page, and we will try to forward these questions to Dr. Hakim so that she can answer. And if needed, we will have another presentation, another show with her on the update. Now, before we thank you, Dr. Nausheen, once again for your awesome job, and we are proud of your work in the field. You're dealing with the COVID patients, you're serving the people, and with people like you, we feel safe. Thank you.
Thank you so much.
Dear audience, thank you so much for joining us, and we hope you have enjoyed this lecture and got some information. Please follow the instructions. The video will be available on our Facebook page. So if you need to go through any part of the lecture, or if you want any further information, you can check back. And it is our pleasure to announce that we will continue this kind of shows on other aspects of COVID, health issues, mental issues. So we are planning to do a show every month. So please stay with us and be safe. Hope you all enjoy good time with your family and friends, but of course, maintain the health regulations, social distancing, mask. Don't forget to follow any rules, any health regulations. And of course, don't forget to take the vaccine as soon as you become eligible. So until then, hope to see you soon. Until then, have a wonderful time and have a wonderful night. Thank you. Thank you. Good night.